So if I look at the other things on the keto continuum, one of the places we start when people ask about fat is they want to know what their cholesterol is. And I have the traditional look into cholesterol that I've done for lots of patients. I've done this for 20 years. It wasn't until this last season where I've really said, boy, do not look at these cholesterols without having a highly sensitive C-reactive protein. By golly, don't look at your cholesterol for the first 6 months of a ketogenic diet. It is fat. You are looking at where and how much fat is being moved around. And in order for you to get the benefits of a fat, you have to have enough fat. So this would have been the traditional test that I would have done in the past, which would be total cholesterol. I've been a stickler about highly sensitive C-reactive protein. That's the number way at the bottom there, HSCRP. Anything under 2, it keeps me from kind of getting really excited. Anything under 1 is awesome. This gal had been on the ketogenic diet. This is one of her labs before the ketogenic diet, and that one in May, or I think she was keto in both of the 2019s, but she wasn't keto in 2017. And what I tried to explain to every patient when we were looking at cholesterol with a ketogenic diet was, you get that cholesterol's a hormone, right? It is a fat that also transitions you into these fat-based hormones. And when you look at the ketogenic diet, the reason why they feel so good is because before you have the ketogenic diet, that red line showing the standard American diet shows that the potential for the maximum amount of hormone produced is severely blunted on the standard American diet. I'm also speaking standard American diet. I'm talking about the people who have insulin resistance. Their blood sugars are still normal. Well, to me, they're not normal. They're not, 60 to 80. They are morning fasting sugars that creep up into the 90s and above 100. Their insulins are high. They just don't know it. Another way to say, who is insulin resistant is their Dr. Boz ratios are clearly above 100. Often they're above 200. And that is looking at their insulin. Those with that red line, that very low level of hormone, they don't have abundant fat-based hormones. And that standard American diet keeps them low. If you want to be able to say, wow, you look like you're reversing age, you have so much energy, you focus, your skin looks younger. What else do I hear? Your joints, their joints don't hurt. They can fast without it being this awful drama. It doesn't feel that bad. And the reason it doesn't is because their fat-based hormones are abundant. And those fat-based hormones do not replace overnight. You've been starving them for years. And I mean that by saying a low-fat diet, standard American diet, high carbohydrates, high insulin, all create the chemistry that makes it very difficult for you to make these fat-based hormones. And you say, well, what are you talking about? What is a fat-based hormone? So here is cholesterol is one of those fat-based hormones. And when people start on the ketogenic diet, their cholesterol is going to go up, especially the total cholesterol. I tell them, don't look, especially not the first 6 months. I might even talk them into the first 12 months. I would have them looking at about 3 months in, I would have them looking at that omega-3 test. It's something you do at home. You don't need an order from your doctor. It's super cool. The link is there below. If not, it's on bozmd.com under Dr. Boz Favorites. And I can't tell you how many patients have come into me over the years. And let's just talk about vitamin D. Cholesterol, through a transition of an enzyme, turns into vitamin D, a couple of enzymes, but it is your vitamin D. When people say, I have this low vitamin D, and I take the vitamin D and I can't get it higher. In part, that's because the supply chain, the part that becomes vitamin D, comes from fat. And when you eat no fat, or if you eat fat in the setting of a bunch of carbohydrates, which means that insulin is going to take your fat and tuck it away really quickly, hardly giving it an opportunity to supply the hormone chain that you need to do in order to have these hormones higher. Vitamin D is predictive of cancer. Vitamin D is predictive of brain function. Yes, bone health and some of the other that's important. But I'm talking about life quality. Vitamin D is one of those universal, if you give me just a few tests that I get to check on somebody, I would check vitamin D. Vitamin D just says so much about a patient and their life expectancy, what's their risk of cancer, what's their risk of cardiac health. Vitamin D does a better job than a cholesterol panel does. And when it's low, the chances that you're going to repair from an injury, from an infection, become worse the longer it stays low. How do you fix it? You got to put fat in the body in order to get the vitamin D supply chain. And I'll tell you, your body doesn't give it to vitamin D first. It gives it to things like cortisol, because cortisol is super important for your stress response hormone, for keeping your blood pressure high. So cholesterol, 1/4 turn of cholesterol turns into cortisol. And as much as high stress causes high cortisol and it makes you inflamed. Yeah, but I'm talking about the burst of cortisol. That's what a ketogenic diet allows you to do, is we don't want a constant supply of these hormones. We want them to peak and then go away. They can't do that in the setting of this constant inflammation that happens when your blood sugar's hanging out at 95, 100, 105 in the morning instead of between 60 and 80 in the morning. That is a normal blood sugar. We've just lost sight of that over the years of being overweight and having high insulin. So when you say how much fat is the right amount of fat for a ketogenic diet, it starts with replacing the supply chain. And I can't tell you the number of patients that have reached out saying, my sex drive is better. I'm like, yep, it comes from fat. They come from hormones. Your replacement of those fat-based hormones start with how well your body can access it, which means cut down the carbs, decrease that insulin, decrease that Dr. Boz ratio, and keep eating fat until that magical day when you miss a meal. You miss a meal. You don't think that's possible before you step on the ketogenic diet. And the day it happens is such a miraculous part of this equation. Other hormones that I didn't put on here would be peptide YY, cholecystokinin, knowing that your leptin and ghrelin systems are going to one's going to decrease, one's going to increase. You're going to feel that satiety and fullness. And they come because those hormones are built from fat. They're built from cholesterol. Without that around, you're going to have a really difficult time succeeding on the ketogenic diet for a long time. Again, on this channel, we are Ketones for Life. We don't do this a flash in the pan. You're welcome to learn plenty and then do what you need to do. But in my experience, Ketones for Life improves not just the longevity, but the immune systems and the brain health. And this is just one of the places I was going to show you that cortisol is important, is that cortisol does actually stimulate blood sugars to be released in the morning. That is the same cortisol. I talk about that as your morning wake-up call is from cortisol. Again, that's a fat-based hormone.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.